Unless we act, and act now, none of this will change.
President Obama visits a Washington area children's hospital in yet another publicity push for health care reform. It's getting close to crunch time on Capitol Hill, and public opinion polls show cracks in support for proposals to overhaul the health care system. The president and congressional Democrats are rallying for support, as political reporter Nick Boger found in Hollywood.
And the system has simply stopped working.
A Democratic congresswoman mounts a plea for health care reform outside Southeast Mechanical Service, an air conditioning sales and repair outfit in Hollywood, where business is down but health care costs are up a lot. Larry Cooper, a co-owner.
It's really, really scary stuff.
The company provides health coverage for 36 of its 46 employees.
The cost went from $17,000 to $20,000 last year, and Cooper says 15 to 20% premium increases are the norm.
Premiums grow, but coverage shrinks. John Oliver's daughter Amanda was diagnosed with diabetes 6 years ago.
And when she was first diagnosed, the insurance covered most of the stuff. So over the last 2 years, it's gone to where it's cost me close to $1,000 a month out of pocket.
Wasserman, Schultz, and House Democrats say the answer is reform that would, among other things, add a government-run health care insurance plan, though not for everyone.
If you like your coverage that you have now, if you like your current plan, you'll be able to keep it.
Wasserman Schultz concedes people are getting concerned about the cost of reform. Congress's own budget watchdog predicted reform plans could cost billions, though Democrats say revised forecasts are less gloomy.
Not only does it say that the House bill would be deficit neutral over 10 years, but would actually produce a $6 billion surplus.
But Republicans are running ads calling reform plans a risky experiment, and the party chair likens it to socialism. GOP Congressman Lincoln Diaz-Balart, headed back to D.C., calls the House reform plan fatally flawed financially.
We have to cut over $500 billion from Medicare and Medicaid. It doesn't work.
Proponents call that a scare tactic, saying it's the current system that has us headed for economic ruin because the uninsured don't get preventative medicine. Pat Diaz is a hospital nurse in Tamarac.
I see my patients now, as opposed to years ago, come in a lot sicker.
Soaring healthcare costs threaten small businesses like Southeast Mechanical and make many big businesses less competitive in the global marketplace. Does Larry Cooper think Congress will act to change his healthcare headache?
It's something that has to be done for American people.
In Hollywood, Nick Bogert, NBC6.